Well, welcome back, everyone. You know, September is Ovarian Cancer Awareness Month, and joining us to share more information on this is Dr. Rhonda Medina. So thanks so much for joining us here, Doctor.
Thanks for having me.
All right, so can you tell us what ovarian cancer is and who is most at risk for developing ovarian cancer?
So ovarian cancer is obviously cancer of the ovaries. The people that are more at risk are those that have more months of ovulation, basically. So people that haven't had children, that start periods earlier and have later menopause. Overall, though, it is basically something that's in older women, usually over age 50, but there are some that are more at risk and can have it earlier.
Right, so many women might not know the symptoms to watch for. So what are some of the warning signs of ovarian cancer that people should be aware of?
So the big problem with ovarian cancer is that it does not cause many symptoms. Usually when you finally do have symptoms, it's advanced stages. Symptoms can be lower abdominal pain, pelvic pain, or just discomfort, sometimes just bloating.
Yeah. So what should women do if they're experiencing these symptoms, and how can they advocate for their health in those situations?
So it is always important to have your annual exam, because the only screening tool that we really have for ovarian cancer is the pelvic exam. So as long as a woman has her ovaries, she should be having a pelvic exam every year. If the clinician feels any mass or fullness in the pelvis, we usually get an ultrasound, and the ultrasound will help us determine if they are at higher risk of having ovarian cancer, or if there's any concerns about that.
Right. So for women concerned about their risk, what screening options are available? Is there anything that they should be doing regularly to catch ovarian cancer early?
So like I said, the annual pelvic exam is the #1 screening tool. And if we find anything that doesn't seem normal, then we get an ultrasound. Based on the ultrasound, if we see a cyst or a mass, it doesn't mean that it's ovarian cancer, but we do further testing, whether that means, there's the CA-125, which has been the gold standard of just monitoring any ovarian mass. But there are newer tests now that are blood tests. It's called OvaWatch or OvaOne, and that can tell us, that stratifies the patient as far as their risk factors, and it tests for some proteins that can be more associated with cancer, and so it tells us if we have to worry about it or not. And if there is any concern, then a biopsy or actually removing the cyst, mass, or the whole ovary is what we would probably recommend.
Yeah. So, Doctor, I want to thank you so much for giving us all your knowledge and also making sure that our viewers are out there that are stay safe. So thank you so much.
Definitely. Thank you very much.
All right. Well, don't go away, because we have more when we return.